Begin with another antimetabolite drug, that is Azathioprine, 6-mercaptopurine, mycophenolate mofetil. Let us see one by one. First is Azathioprine, 6-mercaptopurine. If you see, this is a purine synthesis pathway. Here 6-mercaptopurine and Azathioprine inhibit the conversion of PRPP to IMP so that AMP and GMP will not form. That are the purine's final synthesis pathway products. So if these are not formed, the purine synthesis is stopped. You know that purine is a nitrogenous base, so if this is stopped, the DNA function will stop. So these drugs can be used as anti-neoplastics because they are stopping the DNA synthesis. And these drugs, especially 6-mercaptopurine, azathioprine, also can block the S phase of cell cycle. And mainly these both are activated by HGPRT. As HGPRT is activating them, they will inhibit this process. So finally they'll inhibit purine synthesis. So this 6-mercaptopurine can be used for treatment of some hematological cancers like ALL, and it can also be used as immunosuppressive drug, so that if you suppress the immune system, then of course there is more rise of infection risk. And this can be used for the treatment of rheumatoid arthritis and also inflammatory bowel disease. But the side effects of this disease are hepatitis and pancreatitis. So if you use these drugs more, it may lead to hepatitis and pancreatitis. And one more thing, 6-mercaptopurine, if it is combined with a drug called mycophenolate, this can cause myelosuppression. Myelosuppression is suppression of bone, like myelosuppression. What is this mycophenolate? Let us see now. So this mycophenolate is also in this purine cycle itself. This mycophenolate inhibits IMP dehydrogenase, which is an enzyme which converts the IMP to GMP. So if GMP is not formed, even the lymphocyte count will also be decreased. So purine synthesis is also blocked here. So this drug can also be used as anti-neoplastic drug. But this is also an immunosuppressant drug. So you can see here mycophenolate, which is an immunosuppressant drug also. So this will decrease the GMP, this will decrease the lymphocyte, used in immunosuppressive therapy, also used in rheumatoid arthritis. Side effects are GI distress like nausea, vomiting, diarrhea. Of course, this will also lead to rise in infection risk because it is an immunosuppressant. Okay. So finally coming to another drug, that is allopurinol. Allopurinol is actually used to decrease uric acid because it is used in gout like condition where uric acid is more, it is accumulated. So this is a xanthine oxide inhibitor. We'll discuss about this drug more in detail in uric acid drugs, but you can see here this is a xanthine oxide which converts hypoxanthine to xanthine and xanthine to uric acid. So if you inhibit them, uric acid will be dropped. So if this kind of drug it is used together with 6-mercaptopurine, then it will lead to some problem, like it will increase the toxicity of 6-mercaptopurine, and that will lead to rise in more side effects. Because if you block this xanthine oxide, that will lead to again rise in more PRPP and HGPRT. So because of that, it may activate this drug more, so that more side effects like hepatitis, pancreatitis, which are side effects of 6-mercaptopurine. So by this we are done with this anti-metabolite drugs.